Good morning, everyone. I'm Noelle Spears. I'm the Vice Chair for Education for the Department of Pediatrics, and I am thrilled to welcome everyone here to our 31st annual Maura Whitehead Memorial Lecture. Dr. Maura Whitehead was a resident here from 1984 to 1987 at Children's Hospital of Pittsburgh, and she was a wonderful resident, smart, dedicated, warm, compassionate, and particularly interested in the care of children facing adversities, especially children living in poverty. She, in fact, was the inspiration for our core residency program that focuses on leadership, advocacy, and service. After graduation, she served as the pediatric chief resident at Mercy Hospital, where she continued to develop her skills and her interest in developing community health. Maura died unexpectedly midway through her chief year, leaving her family devastated by the sudden loss of this spirited young woman and promising physician. Maura's family, friends, and colleagues established this annual lecture in her memory intended to educate, stimulate, and motivate the medical community to consider issues that Maura would have found sensible. Previous Whitehead lectures have considered medical problems associated with policy, poverty, and bioethical issues, amongst others. We welcome back Dr. Peter Thorne, Moira's husband, who is here with us every year and graciously last year gave the lecture on climate change and health. Through his vision, we've established the Maura Whitehead grants, which we began 2 years ago, that support innovative community health-based children's initiatives that are led by a pediatric trainee. Our first project, led by residents Dr. Rohan Rao and Perry Levy, assessed barriers to firearm safety storage counseling, was presented at PAS last year and resulted in a website created by residents to educate others on PA gun laws, safe storage, and resources. A huge thank you to Dr. Jennifer Wolford, who runs our core program and helps annually with the Whitehead Lecture and Grants and could not be here today. She sends her thoughts and love. And to Carol Ashby from the foundation, who's with us, who helps us every year, and we could not do this without her. So we have a real life superhero with us today, and I am just so excited to introduce Dr. Annie Andrews to all of you today. Dr. Andrews is a pediatrician and mom who's dedicated her career to fighting for a brighter future for all children. After working as a pediatrician for 15 years, she decided to run for Congress. She was a Democratic nominee in South Carolina's 1st Congressional District in 2022, and this past May, just 5 weeks ago, she launched her campaign for U.S. Senate in South Carolina against Lindsey Graham. Dr. Andrews is an accomplished gun violence prevention advocate and researcher and is the senior advisor at Everytown for Gun Safety and Moms Demand Action. After running for Congress in 22, she founded our nation's only political action committee for children, appropriately titled Their Future PAC. The first of its kind PAC aimed to help elect leaders who are willing to put kids first and supported 2024 Kids First U.S. House candidates. Dr. Andrews received her medical degree from University of Cincinnati College of Medicine and went on to complete her pediatric residency at Cincinnati Children's Hospital Medical Center. She resides in Mount Pleasant, South Carolina with her 3 children and works part-time as a clinical professor of pediatrics at George Washington School of Medicine in Washington, D.C., where she cares for children and adolescents at Children's National Hospital. Please join me in a warm welcome for Dr. Andrews as she discusses her journey through gun control research and advocacy to political action with a call to action to physicians. Dr. Andrews.
Right, good morning. Thank you all so much for that warm welcome. It really is an honor to be here. And I said this last night at dinner, but truly thrilled to have 24 hours to spend with a bunch of pediatricians after spending most of my time in the political world. It's very refreshing and reminds me of my roots. So I don't have any traditional disclosures, but I'm going to use this time to tell you my story of how I got off the sidelines and what I had to lose and what I lost. And I actually was updating these slides, and I always used to say I would do it all over again in a heartbeat, but clearly I am doing it all over again. And I want you to understand that I'm doing it because I believe so deeply that our kids are worth it. So we are going to cover some of the epidemiology of pediatric firearm violence, talk about one specific evidence-based approach, which sounds like something you all are working on as well. And then I'll tell you what I see as really important steps to becoming an effective physician advocate. And finally, and most importantly, justify political action for America's children. So I always start by saying this because I get accused, and some of you I'm sure do as well, nearly daily these days, of using kids for politics, using my own kids, using my role as a pediatrician to advance my own political agenda. Really nothing could be further from the truth. And in fact, my political agenda is rooted solely in the fact that I care so deeply about America's children. And what I'm trying to do is use our political system to benefit children. And I want you all to join me on that journey. And I hope that after today, you understand why. So you kind of just heard a little bit about me, but who am I and why am I here? First and foremost, I'm a mom to my own 3 incredible children. I am a pediatrician. I spent 15 years being a very traditional academic pediatric hospitalist, health services researcher, grant-funded asthma researcher, fellowship director, advocacy curriculum director, and I took a huge pivot in my life, and I'll tell you why. And I want to motivate you to take huge pivots or small pivots, whatever suits your fancy. As she said, I'm a gun violence prevention advocate, a former congressional candidate, the founder of our nation's only political action committee for children, and a current candidate for U.S. Senate. So these are my 3 kids, and they are the reason I do everything I do. And really, the thing that gives me the courage to stand in front of you today, the thing that gives me the courage to do something as monumental as run for the US Senate against someone as entrenched in Washington, D.C. as my current opponent. These children, my children, drive me to do this work. And what we all share is, our patient experiences at the bedside of sick and injured children. And those children also drive me to do what I do. And I hope that by the end of today, you feel a little bit braver and a little bit more compelled to push yourself outside of your comfort zone on behalf of the vulnerable children that we all have the privilege to wake up and care for every day. So drilling down a little bit on how I got to where I am today, because I think folks who just heard about me this week or last month don't really quite understand what a huge pivot this was for me and how this is not something anyone who knew me back in my residency days would have predicted I would do. But November 2nd, 2016 was the day my youngest daughter, Evelyn, was born. And of course, 6 days later was a presidential election. And I'm sure many of you have vivid memories of that day. For me, it was being a sleepless mother of a newborn baby girl, sitting up in my bed, nursing her, putting her down, nursing her, putting her down, being weary-eyed, and watching the results of the election come across my phone. And really sitting there with a sense of disbelief about the world as we knew it and what world I was bringing my own children into. I remember looking at her face and thinking, oh my God, what have I done? This isn't the world I thought it was. Here, I brought this beautiful girl into this world. What am I going to do about it? And something inside of me shifted that night, made me realize that I was going to have to do a little bit more, get a little bit more involved. Of course, I didn't get up the next day and get involved. I still had a 7-day-old infant at home, but I'm not that much of a superhero, but the date on here is wrong. That should be November 8th, 2022. So 6 years after November 8th, 2016, there I am on election day as a federal candidate for office. So I went from a mom of a newborn with absolutely zero political credentials or experience to a candidate for US Congress in a matter of 6 years. And that is a pretty aggressive on-ramp and a pretty dramatic way to get off the sidelines. But I tell you that so that you can understand you can do that, you can do something bigger, or there's so many things you can do that aren't quite as big that we are all fully qualified to do. So the other part of my story occurred on February 14th, 2018, which was the day of the tragic school shooting at Marjorie Stoneman Douglas High School in Parkland, Florida. I was living in South Carolina. I didn't know anyone who was in the building that day. I didn't know anyone who was directly impacted. Some of the survivors are now colleagues and friends of mine. But that was the first mass school shooting that I experienced as the mother of a school-age child. That is only a sentence that a parent in America would ever even dream of saying. And something about that just really motivated me to do more. It really lit the fire inside of me. In the days following that shooting, as I was dropping my oldest daughter, Gracie, off in the kindergarten drop-off line, watching the armed police officer patrolling the drop-off line, watching her get out of the car with her bright pink Pottery Barn Kids unicorn backpack on, walking into that school building, not knowing how vulnerable she was because of the way in which all the adults in the room had failed her so deeply. And of course, now that I know so much more about the epidemic of gun violence, I understand that my daughter is very safe in her classroom. But it was this personal motivation and concern for my own, selfish concern for my own children's safety that got me off the sidelines. And in some ways, I regret that it took a personal concern to get me off the sidelines, but in a lot of ways it doesn't matter because it compelled me to act and I acted. And what I'm doing today is a very result of my response to that shooting. So I went home that day and I was engaged politically enough to have saved the office numbers of my elected people in my phone. So I went home and I called Senator Tim Scott's office. I talked to a young aide and he said, you know, he's a Second Amendment guy. He's not going to do anything different. And I felt incredibly deflated and dismissed in that moment. And then I called my other senator's office and he has a habit of not answering the phone. So I didn't have the privilege of talking to anyone in that office, but I hung up the phone and I was standing in my bathroom at home and I started crying, which was not a normal experience for me at the time. And it just told me that something was happening. I needed to do more. I needed to find a way into getting more engaged in my community and actually contributing to building the world that I know that my children and every child so desperately needs and deserves. So I found Moms Demand Action. I found the local chapter. I went on Facebook. I found out when their next meeting was. I put the date on my calendar and I forced myself to walk into that room. One day after rounding at the hospital, downtown Charleston. I was exhausted. I got in my car. I saw it on my calendar. I wanted to go home to my babies, but instead I forced myself to walk into this room full of strangers and making that one small decision that day, pushing myself very slightly outside of my own comfort zone, really truly changed the trajectory of my personal and professional life in every way possible. So I'm going to talk later about doing one small thing. This is a small thing I did on one day back in 2018, and it truly changed my life. So I joined this organization. I very quickly understood the value that I could bring to the work that they were trying to do in my community, because they were talking about their gun safety program called Be Smart, which is about talking to adults about the importance of secure firearm storage as a means to reduce the incidence of pediatric firearm injuries. And they literally said in that room, we've been trying for years to make connections at the local children's hospital, but it's proven to be really difficult. They didn't know who I was. I raised my hand. I said, I've worked there for a decade. I think I can help. And I needed that. I needed that lane. I needed to find my role in the movement so that I felt like I was helping them and not just them helping me by giving me like the sense of feeling like I was doing something. So I had an incredible resident mentee with me at the time. I took the program back to my children's hospital. We started training all of our residents about how to talk to families about secure firearm storage. We did a quality improvement project that was published in Academic Peds. And we really changed the culture around gun violence prevention at my former institution in this southern state in the US. And then as a trained researcher, I mentioned I was a health services researcher studying asthma. I also remember very vividly in the days after that Parkland shooting, sitting in the parking garage, as I did every morning, and thinking, am I really going to go back in there, pull up my database, and start clicking away in my SAS programming and continue to study prescription medication use in children with asthma when children are getting shot in every state, in every community, in every day in this country? And to me, it just seemed like I can't spend the rest of my career doing what was important work. I can't do that when children are being shot. So I really sort of gradually shifted the entire focus of my research career. I used the skills that I had gained as an asthma researcher and getting my master's degree, learning how to use these databases to give us answers to these problems. And I really changed the focus of my research career and started to dive deeper into understanding this problem. This is not my paper. This is Dr. Rebecca Cunningham's paper that I like to start with. These are old data now, but this was published in the New England Journal of Medicine, where she outlined the top 10 causes of death for children in 2016. So this is years ago. And I think it's important to look at this table on the left because you can see after they go through all causes, you can see motor vehicle crashes being the leading cause of death for children in the US in 2016. And right under that, you see firearm-related injury. And then it's important when you're talking about firearm injury in children to understand there's 3 different what we call mechanisms of injury, which include homicide, suicide, and unintentional. When we're talking about pediatric firearm injuries, homicide are the majority, suicide are approximately a third, and unintentional shootings where children gain access to an unsecured firearm, unintentionally pull the trigger, injuring themselves or someone else, make up about 5% of the shootings. Those data have not changed. But what I like to say is look beyond firearm-related injury in this table at, cancer, suffocation, congenital anomalies, heart disease, burns, respiratory disease, and think about all the time that you have spent so far in your medical training learning about those other diseases, and contrast that to the amount of time you spent learning about the epidemiology of firearm injury, the prevention of firearm injury, and why is that? It's because this topic has been so deeply politicized that we have not been a part of identifying comprehensive public health approaches to addressing this, and it has not routinely been a part of our medical training. And that's a huge problem and a huge reason why we are in the position we are in today. If you look at the graph on the right, you can see data over time, and the only thing you need to get from this data is you can see what's about to happen, what we all know has already happened. But as we as pediatricians were part of a really effective comprehensive public health approach to addressing kids who die in car crashes, we were asleep at the wheel when it comes to kids who die from being shot. And think about all the parties that were involved in reducing the number of kids who get injured or die in car accidents. It's our lawmakers, it's also the auto industry, it's the car safety industry, it's pediatricians, it's local law enforcement. Truly a beautiful testament to the effectiveness of comprehensive public health interventions, of which we have not yet taken to address the public health crisis of firearm injury in children. So we all knew what was going to happen when the CDC released their updated 2019 data, but myself and some of my colleagues down in South Carolina published this paper in Pediatrics, which just illustrated that what we thought was going to happen was exactly what would happen. Depending on how you look at the data, around the year of 2019, gun violence became the #1 cause of death for children in the United States. It's really important after you say that sentence that you say that gun violence has been the #1 cause of death for Black and brown children in the United States for decades. But in 2019, it became the leading cause of death for kids in this country. I talked about the 3 different mechanisms of firearm injury and death among children, and it's important for those of us who are in the business of prevention, which we all are as pediatricians, to understand across the age spectrums, which mechanisms are more prevalent. So in this table, in this graph, the gray represents homicide, which I already told you is the vast majority of pediatric firearm injuries and deaths across all age groups. But the blue are those unintentional shootings and injuries. And you can see those are more prevalent the younger the child is, which makes sense. We all understand the developmental stages, and that makes a lot of sense. The orange is suicide. So you can see we need to start thinking about suicide prevention in children as young as 9, and then the proportion really increases as soon as children reach that 10 to 14 age bucket. So we need to be thinking about different preventative measures depending on the age of our patients, just like everything we do in pediatrics. So to drill down a little bit deeper, because I want to talk about this specific intervention that we can all be a part of, which is talking to adults about the importance of secure firearm storage. This is a critically important intervention. It is the lowest of the low-hanging fruit that we can do to reduce the number of kids who are shot in this country, because 13 million kids in this country live in a house with a gun, and 4.6 million children live in a house with a loaded, unlocked gun. So no matter your personal gun ownership status, your parents' gun ownership status, we don't know about the other homes where the children we love are going or where our patients are going. The majority of children in these gun-owning households know where the guns are, just like they know where the Christmas presents are in December. A third of them have reported handling their children's guns, and the parents are completely oblivious that the kids know where the guns are and that they've handled the guns. So this is, an incredibly risky situation that so many American children find themselves in. And I care about this because I know very clearly that 90% of those unintentional gun deaths and injuries occur in the home. 90% of our firearm suicides occur in the home. And when guns show up on school grounds, when the person with the gun is under the age of 18, over 75% of those shooters got that gun from their home or the home of a friend or relative. So if we reduce child access to unsecured firearms, we can dramatically reduce the incidence of unintentional shootings in children, of youth firearm suicide, and of guns showing up on school grounds. And it really takes pretty small actions from us pediatric healthcare providers to achieve that goal. So those of us in the business, when we say secure firearm storage, the gold standard is guns that are locked, unloaded, and separate from ammunition. People that are smarter than me have been doing a lot of research on this subject, and we're starting to understand that we can't let perfect be the enemy of good. A lot of folks that we care for own firearms to protect their family. And if you go into the room and you say, I'm sorry, but you're going to have to store your ammunition here and your gun locked over here, they're just going to stop listening to you. We can't expect them to meet us where we think the gold standard is. We need to be okay with slowly changing behavior over time and recognizing that a locked but loaded gun in a bedside keypad safe is much safer than an unlocked loaded gun in a nightstand drawer. And so we need to be more open-minded. We need to understand the gun owning reasons for our patients, and we need to meet them where they are and come up with a solution that they will actually enact. Just like we don't expect our obese patients to stop drinking all sugary beverages after we say that sentence once, we can't expect gun owning households to change all of their behavior around gun ownership after one conversation. We have to build trust with them, and we have to meet them where they are. But we do know that if we can encourage and if we can change parental behavior and lead to more securely stored guns, we can dramatically reduce the incidence. This study published by Dr. Grossman showed a near 80% lower risk of self-inflicted firearm injuries, which are the suicides, and an 85% lower risk of unintentional shootings in households with locked firearms and separate locked ammunition compared to households with unlocked and loaded firearms. So it is an incredibly effective intervention. The other thing you need to know that I didn't include this slide in here is that Dr. Sherry Barkin and her team published a really incredible study that showed that pediatricians, when they deliver secure storage information at the point of clinical care with the provision of an inexpensive secure firearm storage device like a cable gun lock, the brief clinical intervention actually leads to statistically significant behavior change in the home. So of all the things that we talk to our patients about, we should feel a sense of self-efficacy that if we actually complete these interventions in a patient-centered, culturally appropriate way, we can actually lead to secure storage behavior change in the home and therefore protect children in our communities. So this slide is just to show you what I was trying to say before, that the series of events happened in my life. I got involved with an existing community organization that was doing the work. I showed up and I listened and I learned from them and I helped them achieve their goals. And I used all the skills I had already gained as a trained pediatric researcher to start to study the problem of firearm violence in this country. So I developed an advocacy curriculum for our residents down at MUSC. We started changing the culture around gun violence at my institution, and I was in a really great place. I was doing the advocacy work. My chair was actually paying for some of my time to lead the advocacy work. I was doing the research. I was publishing papers, but I wasn't satisfied. And I decided to take that next big step. And as my dad says, why in the world would I do that? Why would I get into this world of politics, which is so unsavory and so much the opposite of this lovely world of folks who show up every day to work in children's hospitals? But there are some really, really clear reasons why I understood that staying in the lane of research and advocacy was just not enough. I don't think there's ever been a more clear illustration of elections matter than these two pictures right here. So during the most recent Biden administration, we were making leaps and bounds of progress on the issue of gun violence prevention in this country. We had the first ever White House Office of Gun Violence Prevention. The Surgeon General, for the first time, declared this to be the public health crisis that all of us in this room know that it is. And all of that progress was just wiped away on one day in November 2024. And now gun violence is no longer officially considered a public health crisis. That office has, of course, shut its doors. And a lot of the funding that was just starting to ramp up to study this problem is just gone. So elections matter, and we can have the best intentions in the world. We can study the impacts of these interventions. We can write our policy papers. We can write our op-eds and our letters to the editor. But if we don't change who gets elected, none of that's going to make the difference we need it to make. So I started to try to figure out a way to explain this to people like you, and why the next step from advocacy into politics is such a critical step and a place where we have all fumbled the ball. So this is, in its very most basic sense, the way I boil it down. So to me, research is finding an answer to a problem. That is a safe space for all of us. We understand the importance of research in our daily work. Policy, which we see organizations like the AAP do really well, is turning that answer, that identified answer, into a systemic solution that can help our patients on a bigger scale than what we can do individually bedside to bedside. Advocacy, in my view, is drawing attention to the problem and your identified solution, your policy that is research-based. And we are all also very comfortable in that space. That is really the foundation of what the AAP does. That was something that our field was founded on, the importance of child advocacy. We are very comfortable using the word advocacy in buildings and rooms like this. People always get a little bit confused about what lobbying is. Lobbying is really just like the official profession of advocacy. You know, registered lobbyists are the folks on the Hill in state houses who are advocating, but in an official sense. That is convincing people with power to care. That is what we do on AAP Advocacy Day when we show up at our state capitals or when we show up on the Hill, put on our white coats. We are trying to convince the people in power to care about the problems we care about and to understand the solutions that we have come up with to those problems. And that sounds great, doesn't it? But politics is changing who has the power. And if we don't do that, then we are truly abdicating our duty as pediatric professionals to catalyze and expedite the change that children in this country so desperately need and deserve. I spoke to a lot of pediatric healthcare leaders recently, and I used this metaphor. Say your department is hiring a new chair, and you're invited to suggest names, you're invited to interview the candidates, you're invited to sit in on the meetings where you rank the candidates. Would you ever in a million years give up the opportunity to put your finger on the scale for the type of leader that you think your institution needs, the one who's going to fight for the priorities that you want to fight for? No one in academia would ever give up the opportunity to affect who gets put into a leadership position. But as a profession, when we don't engage in politics, when we wait to see who gets elected, and then we put on our white coat and we go talk to them, that's exactly what we're doing. We're giving up our power by not engaging in the process of selecting our leaders. So as I started to understand this, I decided to do something incredibly dramatic with, no political wherewithal, no political network whatsoever. But there was an opportunity in South Carolina to run for a seat that had been red, and then it flipped blue and then back red, and it was purple at the time. So I just raised my hand, and no one came and knocked on my door and asked me to run. I literally said, I think I want to run for this seat in Congress. I talked to one political person in South Carolina who told me the next person to talk to, and I did it that way. I think a lot of people think you need to be asked to do these things. You don't need to wait to be asked. You need to just raise your hand and do them. So I decided to run for Congress back in November 2021. And it was really a life-changing experience. Like I said, I had no political Rolodex. My cell phone was filled with other moms' phone numbers and other pediatricians' phone numbers, which is like literally the least powerful network you can have. And my contact list looks different now, but I'm committed to making my previous contact list actually politically powerful by convincing you all to engage in politics. But running mattered, even though I lost, running mattered. And we talked about this picture last night at dinner because a lot of people saw this because it went viral. And these are two examples of why me being in that race, despite the fact that the district got gerrymandered in the middle of the election cycle, and at the end of the day, there was no way I was going to win that election. It mattered because I could inject my viewpoints, our viewpoints as pediatricians who care about children into the national conversation. And that's what we did with this tweet on the left. And then on the right, that's me at City Hall in Charleston in the wake of Roe falling at a rally organized by Planned Parenthood, where all of a sudden I found myself as a woman and a mom and a doctor on a ballot in this moment when women's reproductive health care was under attack. And I didn't expect to be this person when I decided to run, but I am so grateful that I was able, as a mom, as a woman, as a pediatrician, to give voice to so many women in my community who were devastated that spring and summer. And so it mattered that I was a doctor and I was on the ballot and I could talk about this issue in a way that other candidates couldn't, and I could give voice to the women in my community who were so devastated. But politics is really ugly, and it got really ugly because I was running against a horrible human being who decided to use trans children as a political talking point to attack me. She publicly, repeatedly called me a child abuser, suggesting that supporting gender-affirming care is child abuse, throwing the trans youth in my community totally under the bus. She doubled down and she tripled down, and it was terrible. And it got so bad, and this is, of course, in the aftermath of the bomb threat at Boston Children's Hospital, where I decided I needed to take a full leave of absence from my job because I was so deeply concerned about the people who were listening to our Congresswoman talk about this issue, that they were going to come try to find me at the Children's Hospital, and that was going to put the patients and families at risk. So I took a leave of absence. It was terrible, and I use this slide because it's important to not sugarcoat the journey that I have been on, because it has been really ugly and it's been really difficult, but it still is so important, and I have absolutely zero regrets about putting myself in this position. So some of you may be thinking like, yes, I'm feeling like I want to do more, but I would never, ever be the person who could run for office. And people who have known me for decades understand that that's exactly what I would have said if I were sitting in your shoes as a resident. What I thought before I ran was, I'm not ready. I don't know politics yet. I don't understand how campaigns work. I'm not qualified. I'm just a pediatrician. I'm too much of an introvert. I could never be an effective candidate. I could never command a room like you see the really effective, politicians do. I didn't think I was brave enough. I didn't think I was charming enough to win over voters or to win over donors. I didn't think I was strong enough, and just generally, I didn't think I was enough. Thankfully, I didn't let these things stop me, but these are all the insecurities I went into that campaign with. But what I now know that you need to know is that we're never ready. You're never ready to do your first lumbar puncture. You're never ready as a medical student to walk into a room and do an H&P without someone standing over your shoulder. You're never ready to take your first night of overnight call in the ICU. If we wait until we're ready, the moment will have passed. None of us would be licensed physicians if we wait until we feel 100% ready. And that could not be more true for this moment in this country. You cannot wait until you're ready. You just have to get off the sidelines. This goes without saying in this moment in time, but we are all so overqualified to be contributing to the lawmaking process in the United States of America. I was telling this story last night. One of my friends was giving me a hard time about why I was so invested in helping to elect Kamala Harris and Tim Walz, and he joked, like, Annie, what do you think, you're going to be like Surgeon General or something? And I laughed at the time, but now, you know what, like, the sky's the limit, really. I also understand now, for those of you who are saying, well, I am also an introvert. Introversion is a strength in advocacy and politics, because effective advocacy, activism, and political engagement is all about listening. It's 95% listening and 5% being able to effectively communicate back to the person that you've just listened to. And that's what introverts do so well. I also now understand that the really effective public speakers are the ones that are so passionate about what they're talking about, the ones that have this burning desire to relay what they know to their audience. And that doesn't come from taking a bunch of public speaking classes. That comes from just having that inherent passion and forcing yourself to just do it and do it over again until you're good at it. We have to be braver than we expect our children to be. So if you're sitting there thinking some of this sounds scary, think for a moment about every child in America who goes to school, goes to kindergarten, learns their friends' names, learns how to write their name, learns how to add 1 + 1, and also learns how to hide from a bad man with a gun. Every child in America has to do that when they go to school. We have robbed our children of a sense of physical and psychological safety in a place where they absolutely have the right to feel physically and psychologically safe. And if we expect our children to do that, we can certainly force ourselves to walk into a room full of strangers. We can force ourselves to write an op-ed. We can force ourselves to ruffle some feathers at our institutions on behalf of America's children. I also now know that authenticity is charming, and we have a dearth of authentic political leaders in this country, and you all have a clarity of purpose, a moral compass, and authenticity. That's what gets you out of bed every day. That's what made you choose pediatrics over the other subspecialties that are more highly respected and more highly paid. You have a clarity of purpose. You come to work every day with an authentic goal, and that translates beautifully to the world of advocacy, activism, and politics. We also all have no idea how strong we are until we force ourselves into situations where we have to prove it to ourselves, and we are just generally so much more than we think. So, of course, I lost, and sometimes I like to joke that this is the end of my talk. Thank you so much for coming. But now, of course, you know I didn't stop. I'm still going. So I have zero regrets about running against this person that I ran against, despite how ugly it got, despite the professional consequences that I faced, because I learned something so important that now I am just so driven to share with everyone who will listen. And that is, why do children have no political power in this country? Why? Well, some might say, well, they're minors, they're under 18, they can't vote, and they don't have any money, so they can't donate to candidates or they can't donate to politicians. So of course they have no political power. And I think we all have like some sense that that is true, but I also think we have a naive sense that everybody in DC and in state houses is fighting for kids and deep down really does care about America's children, because it's really easy for politicians to speak in platitudes on the campaign trail. It's much more difficult for them to prove that they actually care about America's children by legislating in a way that proves it. And because I've shown you the difference between our policy world, our advocacy world, and political engagement, I want to show you some numbers to let you know how far behind the 8 ball we are. So in 2023, one way to measure political power is lobbying. This is an indirect measure of who has power in the halls of Congress. But the AARP, ARP, household name, right? Their work on behalf of retired people, Americans over the age of 65. They continue to lower their constituency. Very powerful, well-known organization. In 2023, they spent $16.5 million estimated on lobbying for the things that are important to them and their constituency, which are very important, and we share their goals. It's about protecting Medicare and Social Security and all of that. But you've got to believe when a member of Congress has a meeting with someone from ARP, that member of Congress is going to listen, and they're going to take what that person says seriously because they understand the power of $16.5 million. That same year, the AAP spent $980,000 on lobbying. This is not to ding the AAP. This is just to show you the scale, the measure of the scale of this problem in the way that we have, again, completely abdicated opportunities to put power behind a children-centered agenda. So we're going to continue to live in a world where Medicaid is always on the chopping block and Medicare almost never is until we change this equation here. And it doesn't have to fall on the AAP, but we have to figure out a way to build power behind children. Another way to measure political power, in my view, a much more direct way, is to talk about political spending. So political spending comes in the form often of political action committees, which raise political money and then spend it during campaign season. They donate to candidates, they run ads on behalf of candidates or issues that they care about. This is the most direct measure of political power. All of our other colleagues in medicine have figured out the importance of spending politically. You can see here, and this is just a sample: anesthesiologists, radiologists, emergency physicians, orthopedic surgeons, the ADA, even the pediatric part of the ADA has a political action committee, ACOG. And I'm not talking about $10,000 an election cycle. You can see these numbers. These are important, big numbers. Anesthesiologists spend $4 million in 2024 advocating and lobbying and trying to elect candidates who are up there fighting, and mostly for their profession, not necessarily for their patients, right? And who's not on this list? We are not on this list. The American Academy of Pediatrics is really the only large medical organization that has not, over time, built a political arm. We don't have a PAC. We're the only medical subspecialty that doesn't have a political action committee. And because of that, we don't have political power for children in Washington, D.C. or state houses. So I know I sound cynical, but when we show up on White Coat Day in Washington, D.C. or in our state capitol with our white coats, and people feel good because we're pediatricians and they like pediatricians, and we say, here's this problem, here's the solution, and they take the meeting and it's a great photo op for the member of Congress, and then we walk out, and far too often that piece of paper we hand to them goes on the bottom of the stack. Because they may care about kids, but they have priorities, and their priorities, when we don't marry the advocacy and the policy work with the political power, in this day and age in this country, we're not going to get the results we want. And that is just the cold, hard truth. But the good news is we have nowhere to go but up, literally nowhere to go but up. So after I lost, I highlight this. So I started this PAC, their Future Political Action Committee, the only political action committee for kids. We were active in the 2024 election cycle. We are currently inactive. We shut it down for my campaign, but we also shut it down because it was really, really, really hard. And it is about as close to failure of something I believe in that I've ever come. Yes, I lost an election, but it was really, really hard, so much harder than it needed to be. And it was on the brink of failing even if I hadn't decided to run for office, because it's hard to build a political movement. It's hard to convince people the importance of political spending. It's hard to convince people the difference between political activity and advocacy. And it's hard. It's hard. Not enough people in this country care about our children in a meaningful way. And that's what I learned. But I also stayed really active. So one of the lessons I like to impart is that just because you lose doesn't mean you go away, doesn't mean people don't want to hear. I mean, a lot of people don't want to hear from me anymore, but that people don't want to hear from you. When we lose, we learn so many lessons that we can take into our next battle. So don't not do something because you're afraid it won't be successful, because then we'll never achieve any meaningful success. So I stayed incredibly active. I was one of the 4 women who organized this call that raised $11 million and broke Zoom last summer, almost a year ago. I was the host of Healthcare for Harris, because what I learned through my journey was the importance and the value of my voice as a pediatrician, as a physician who cares. I regret so deeply the first 10 to 15 years of my career where I didn't understand the power of my voice, the platform that we all have as pediatricians, the megaphone that we are handed when we earn that degree and when we earn our credentials as pediatricians. People listen to us. When I got off the sidelines and I started showing up in my community, and I'd be sitting on a stage like this next to people who had been doing the unglamorous, back-breaking work of gun violence prevention in their communities for decades, I'd be there and people would ask questions, and I noticed very quickly that whenever I opened my mouth, even though at the time I knew next to nothing about gun violence, people would listen and they, oh, Dr. Andrews, tell us more. Oh, Dr. Andrews, thank you for that answer. Here's a follow-up question. And the people next to me who had the real lived experience, who would say much more profound things than me, wouldn't have the same attention of the audience. So it became really clear to me that my job in those situations is to use my platform and my megaphone and my credentials to draw attention to the people who are already doing the work, who have the important things to say. And we all share that responsibility. We are the only ones who are at the bedside of sick and injured children every day. And I think because of patient privacy concerns, because of HIPAA, we bottle it all in. We were just talking about this again last night at dinner. that, people who work in healthcare tend to see trauma all day and then go home and kind of pretend like none of it happened, because we have to compartmentalize if we're ever going to enjoy our life outside of these walls. But the pendulum swung too far, and we don't share with the world what it's like to care for children who are hungry and don't know where their next meal is coming from, or children who are being diagnosed with a new chronic disease like asthma or diabetes, and their parents have to stop us when we're explaining the treatment plan to ask us how much the insulin is going to cost. Or kids who come in after trying to kill themselves because their parents haven't been able to access mental health resources in the community. Or kids who have been shot. If we don't share our stories with the world, no one is ever going to understand the degree of the systemic barriers that our children are facing in this day and age. And it is our duty as pediatricians who have the privilege to work at the bedside of sick and injured children to use what we see to catalyze change. So I update this slide whenever I give this talk, and sometimes I just don't even feel like I can, because the onslaught of bad news about America's children and bad news about America's healthcare system, about medical research in this country is truly just too much to bear. But we have to be aware of what is at stake and what continues to be at stake. The headlines keep coming, and they're not going to stop. They're not going to stop. So we have to find a way to do something different. And I don't think I have to convince you all of that. But what I have to convince you all of is that you are fully capable of doing the big, scary thing that will change the trajectory of this world for America's children. I had no intention of running for office again. I really didn't. I thought the PAC would be a good way to create the change I wanted to see in this world. I was happy working clinically up in DC, running the PAC, working for Everytown. But what happened in November of 2024 and what has happened every day since Inauguration Day in January made me realize that I couldn't stay on the sidelines. I couldn't sit by and just hope things worked out. So again, I pushed myself to do something that I never planned to do, that I didn't feel prepared to do, that I didn't necessarily know if I was brave enough to do it, that has a very low likelihood of succeeding, but I still believe it is so important. And I want you to understand that you are all fully capable of doing something just as big, just as meaningful. Think about the million things you could do that aren't quite this big that could help catalyze change. I just highlighted this. The moment for children in this country grows more urgent by the day. I've been saying this for years. It has never been more true than it is right now. Medicaid and routine childhood immunizations are under attack. Medicaid has been attacked. The backbone of children's healthcare in this country is been decimated. At the same time that we're waiting to see what they do to the routine childhood immunization schedule, which will of course impact access to vaccines, and sow doubt and disinformation and distrust in the medical profession that will take us more than our full entire careers and lifetimes to recover from. So I know I don't have to illustrate to you why this moment is so urgent. If not you, who? There is no one more well prepared to get loud on behalf of America's children than America's pediatricians. We can't wait for direction. I like to use this analogy. If you showed up at a burning house and there was a bunch of fire hoses on the ground, would you wait for someone to tell you what to do? Or would you just pick up the fire hose and point it at the fire? As pediatricians, you all are the fire hoses. Just start talking, just start being loud. Don't wait for direction, don't wait for a plan. No one is coming up with a plan. Just do what you can do. There is so much untapped political power within our profession, within physicians generally, but most specifically within pediatrics, because we have not to this point engaged politically, individually or collectively, which means, again, we have nowhere to go but up. And if we start speaking with a uniform voice, collectively and individually, on behalf of America's children in the political world, not just in the advocacy world, but in the political world, I promise you it will be incredibly powerful and could be the thing that gets this country on the right track. We have to understand that politics isn't a dirty word. Now, I'm not up here advocating that you walk into your patient's room with a campaign button on your shirt and talk about who they're going to vote for. That is not okay. Nobody thinks that's okay. We're not going to do that. But healthcare is political, children are political. We have to get comfortable using that word and talking about it in spaces where we think we might not be, we maybe shouldn't be talking about it. And it is absolutely the only way to turn a stack of policy papers into actual policy. I promise you, if you start speaking up, people will listen, just like I illustrated before when I knew next to nothing about gun violence just because of the letters behind my name, which you all also have. People will listen to you. People will listen to you. We have that privilege, so we need to use it. Do something. It's overwhelming. The easiest thing to do is to turn your phone off and to tune out and to hope things work out. But we cannot do that. You've come this far to become pediatricians. You've dedicated your lives to caring for sick and injured children. Just do something, because this is a 5-alarm fire and we've got to push ourselves outside of our comfort zones and we've got to be brave. Also, it's a marathon, not a sprint. We're not going to solve these problems in one election cycle. We're not going to solve these problems after one talk. We have to protect our own mental health while we engage in this work. We have to understand that we're not going to have some celebratory moment in 6 months and 18 months on election night. This is a marathon, but the longer we wait to get started, the longer it will be before we see meaningful change. So I think this is going to be on my tombstone. But it's so true. When I first started getting loud on Twitter, I was talking about secure firearm storage every day, saying the same thing, quote, tweeting articles about children getting shot, the same thing. And that's how I became known as a person who knew something about this issue. That's how I got my first ever invitation when I was just a little baby advocate to give a grand rounds about this issue. You just have to establish yourself. We all have expertise. We undermine our expertise. We diminish our expertise because we surround ourselves with other experts every day. We forget the level of expertise that we have, and we need to use it and just start talking and be so persistent. And you feel like you're saying the same thing all the time because you are, but that is how you break through. As you allow yourself to become more aware of what's really going on in this world and how this is going to impact children here in Pittsburgh and in my hometown of Charleston, it's really easy to feel a sense of despair, especially if you have the news on all day. But I promise you that that action is what allows you to maintain your hope. A lot of times when folks are interviewing me and they ask me if I feel optimistic, and my answer is always the same. I'm a mom of 3 school-aged children, and I spend my days taking care of sick and injured children. If I lose my sense of optimism or hope about what's possible in the future, then how in the world would I ever get out of bed in the morning? How would I do my job with any worth? So we cannot afford to lose our optimism. We also can't afford to lose our joy. So I've also been asked this question a lot lately, like, you know, you bring a sense of levity to the conversation. And I say it's okay to make jokes. And it's also really important that we remember why it feels so good to laugh. Because if we allow them to steal our joy, we will forget what we are fighting for. And that will make the fight so much harder. So there are 73 million and counting children in America, and they all absolutely deserve a bright future. So let's together build it, but you cannot do that without getting political. Thank you so much. I'd love to take questions.